Debbie Taylor, South West Yorkshire Partnership Foundation Trust, Public Health Education Manager. Well, we're Public Health Education team, and we're part of the Health and Wellbeing team in the Foundation Trust.
Yeah.
And we've always, we do a lot of training across the Wakefield district.
Okay.
And we've had a behaviour change programme in place for probably about 3 years now.
Okay, so you were quite ahead of the game really as well, weren't you? Okay.
Yeah. So for us, we sort of introduced it because we joined the organisation last April, and you know, people weren't necessarily aware of the framework. So with our behaviour change course, we've actually sort of mapped elements of levels 1, 2 and 3 of the framework to our training.
All right, good.
We've also offer sort of a half-day course around using the framework and the assessment tool.
Okay.
So we've promoted it within the organisation.
Good.
And they are much more aware of it and very interested in it.
That's good.
Yeah.
So what sort of people have been going on the training then?
Well, people from within the trust itself.
Yeah.
And there's been a couple of senior managers on that. We've had, because we cover the Wakefield district, we have voluntary organisations, prison service, turning point, drug services and alcohol services. It's a real mix of people. So they've all been attending the behaviour change course and also the framework.
Good.
But that was more of a pilot.
Yes.
We've got probably, I think there's 2 courses that are due to be run in the future. I think it was useful for us as a team to actually look at the exercises that we were doing. You know, if we broke the course down, it's a 1-day course, the behaviour change course, and then to sort of map it against the framework, and actually you can then think, oh, that exercise links with that, and so it's been useful for that. It's been useful in the sense that when I've been going to meetings to actually say we're sort of involved at a regional level with the framework, and people have become, I feel we've become, I wouldn't say more high profile within the organisation, but there's interest in us, which is good in this changing time. It'd be nice to actually, whether it would be my team doing it, but certainly within the framework there's elements of mapping against like diversity. Yeah. So whether to sort of try and get that on the agenda of the sort of the team that deals with diversity within the trust, to try and get them maybe to map some of their courses. I mean, we do offer a diversity course, but I'm not sure if we're going to be doing that anymore because of there's other people. I'm trying to probably get it onto the agenda of sort of like the Director of Learning and Development HR. Who is aware of it. Yes. Probably doing a bit more work around some of the, getting his sort of support to try and get people using the assessment. If I'm thinking of it as a manager of a training team, probably the change for us would probably just sort of map more courses and linking that way. But I suppose another change would be to, for people to use the assessment tool so that they can identify things in their joint development plans with the managers, if they wanted to share that. But to see it more sort of coordinated. And I suppose from where I'm coming from, I'm trying to push it forward within the organisation, but it needs somebody higher than me to do that. So more senior management commitment to the framework, rather than a few of us saying, oh, this is really good, and then it just stopping.